Assalamu alaikum and hello viewers as well as new viewers. Welcome to the Lex Talk Show, British Muslim TV. My name is Samina and I'm your host for today. So thank you very much for tuning in. So like always, if you have any questions with respect to the topic of conversation today, then please do not hesitate to ring on 01924 231 083, or you can also message on 07585 835 150. So thank you for tuning in. Like I said, my name is Samina Chughtai and I'm your host for today. So another amazing topic of discussion today. We have an amazing guest speaker today. And the topic today is the day in the life of a neurosurgeon. Yes, we have a neurosurgeon here in the studio today. He is a senior clinical fellow in neurosurgery. He works at the Queen Elizabeth Hospital in Scotland, Glasgow. He is also passionate about healthcare, entrepreneurship, leadership, neurosurgical technology and innovation. He also has a YouTube channel which he runs alongside his friend by the name of the Neurosurgeon. That's the YouTube channel. So without any further hesitation, I would like to welcome this amazing neurosurgeon, Dr. Mohamed Draz. Assalamu alaikum and hello.
Wa alaikum salam.
Thank you so much for coming to the show. I really do appreciate it. And I'm aware that you're an awfully busy individual with your profession. Did you actually work 24 hours today?
That was actually Friday and Sunday, 24, so 48 hours over the weekend.
Right. Wow. Wow. That's amazing. If that was me, I'd probably be able to string just a few sentences, no more than that. But thank you so much for joining us. I really do appreciate it. So I hope I've introduced you as well as I can. But please, if you're wanting to just expand on that and enlighten myself as well as the viewers a bit more about yourself, please.
Thanks for the introduction. As you said, my name is Mohamed Draz. I work as a senior clinical fellow of neurosurgery in Glasgow. I've been doing neurosurgery for about 10 years, originally coming from Egypt, and I managed to do my master's back in Egypt and also my master's in Oxford with a subspecialty in one of the subspecialties of neurosurgery.
Okay, mashallah, mashallah. And how many years did it take you to actually qualify then as a neurosurgeon?
So it's different between countries, but in the UK to qualify, it's training of 8 years, and you have to do also fellowship training, which is like a subspecialty training in a specific specialty of neurosurgery, which can take a year or two. So we're talking average of 8, minimum of 8 years and up to 10, maybe sometimes 12 years of training to be qualified as a neurosurgeon.
Wow, that's really, really impressive. No doubt you had the patience, the tolerance and the passion to carry on for so many years.
Yeah, I mean, it's a long journey and it's tough. You deal with, critical conditions with critical patients. So yeah, it needs a lot of patience and persistence over time. And it's as any kind of skill, it needs training and you have to practice this. You practice this day after day. The more you do, the more you get experience. And the main aim is just to be, to provide the best care to the patients and also to be as competent as you would be for doing the surgeries.
Yes. And it must require a lot of concentration, a lot of focused work for what you're doing as well, and a lot of indeed skill, no doubt. That's why you've got so many experience, and that's why it's taken so many years to get to the stage that you are now at, which is, mashallah, a neurosurgeon. So can you just tell myself and the audience, the viewers, what is neurosurgery? Because I was getting a bit confused with neurology, but I know there is a difference.
Yeah. So the people usually kind of get confused between neurosurgery and neurology. Both deal with diseases of the brain and spine. But the neurologists are more of the kind of the medical part of the specialty, while the neurosurgeons are the surgical part, where we all what we do is mainly operations. So anything that can be, that require a surgical operation, it's done by neurosurgeons, and that involves anything, any operation in the brain and spine, and that includes a variety of conditions that can be trauma to the brain and spine, any tumors that can develop in the brain and spine, any abnormalities in the blood vessels, again in the brain and spine. Also, we deal with a group of patients where we call it functional neurosurgery, where we try to help patients with their quality of life. And here we're talking specifically about patients like patient with Parkinson's disease. When
sorry, what disease was that?
Parkinson's.
Parkinson's. It's your Glaswegian accent, which is mashallah lovely.
So so those patients, sometimes when they fail medical treatments, there are surgical options for them where we implant some electrodes in the brain which can modulate the brain and help them to control the tremors that they have. We have and also we deal with all the what we call it degenerative problems of the spine, or basically wear and tear of the spine, where a patient might have a disc prolapse that might need to be taken out, that causing some compression on the nerves, or if someone who has some slip of the vertebra above each other that requires fixation with putting metal screws in the back to fix the spine. So neurosurgery itself has a wide variety of subspecialties under it, and not every neurosurgeon will be doing everything. So probably will be doing part of it, not the whole thing.
Okay, and I was just wondering, what area of neurosurgery then do you specialize in? Is it operating on the spine as well as the brain?
So currently I do both, but my interest is mainly into the vascular neurosurgery, which deals with problems in the blood vessels of the brain, and also I have some interest in the spine surgery as well.
Okay, interesting. So I wanted to ask you, and I'm sure the viewers are also curious to know, particularly when it's taken you, 8 years or 10 years to qualify? How many years did you say?
So now probably that's my 10th year in neurosurgery, and still a few more years. Probably need to do a fellowship or something before.
Wow, wow.
Something that, yeah.
Wow, still very impressive. So did you always want to become a neurosurgeon, or was it just a natural progression? Did you have dreams of it, when you were a child, thinking, I want to be a doctor, I want to go into the medical field?
No. I always wanted to be a pilot, but I didn't manage to, because of my eyesight. And back in Egypt, it's like, all the most of the Muslim community in the UK that when you finish your high school, you're either a doctor or an engineer. So that led me to medicine at the end. And at the end of the medical school, I always wanted to be a surgeon of some sort. And the selection process when you finish the medical school in Egypt led me to neurosurgery. But when I started, I never thought that I would be a neurosurgeon. But that was the natural selection.
Okay, mashallah. And do you feel that becoming a neurosurgeon, and no doubt, as you said, that it's an ongoing process. Do you find that you've fulfill this purpose? Is this your purpose in life? Is this the legacy that you're going to be leaving behind, or even currently, do you feel that it is what you endeavoured to do, and you're going to continue to do that?
Yeah. So I think the main thing that I want to do is to help other people. I mean, that can be done in many ways. You don't have to be a doctor to do this, but being a doctor or being a surgeon, you can help them in a specific way. And also being a neurosurgeon deals with specific conditions that very few number of people all over the world are neurosurgeons. In the UK as well, not huge number of neurosurgeons. So that feels special in a way that that you can do something to help people in pain or suffering from diseases that affecting their life. So it's satisfying in a way that, when you help the patient that way to control a disease or to get rid of their pain. So yeah, but also try to help people in other ways, spreading awareness, talking about about the diseases of the brain and spine, and try to help people to not to come to harm that would require to have surgery at some point. So all what we want to do is not to see more people, basically, because seeing them means that they might need surgery, and that's the last thing that you want to do for them.
Okay, so does that mean then, as a neurosurgeon, or before they come to you, there's a lot of maybe preventative work that goes behind that before you then use the option of surgery as a last resort?
Yeah. So yeah, I mean, it depends on the condition, but here I'm, mentioning the spine, for example, wear and tear in the spine. A lot of the wear and tear that happens in the spine is in relation to the bad lifestyle, basically. So if we, make people aware of this and try to encourage them to have a good lifestyle, to exercise, to strengthen their muscle and being fit and well as much as they can, then probably we can stop them, from harming their spine and ending up having an operation. But even if I mean, still not everyone having a wear and tear in the spine would require surgery. I mean, surgery is probably 1 out of 10 patients that comes to us with problems in their spine would require surgery. So still, I mean, other things that they can do in terms of rehabilitation, physiotherapy, medications, and all of that.
Okay, well, that's really, really interesting. So we're going to actually have a very, very short break. So, viewers, please do tune in after the break. So if you want a cup of coffee, if you want to get that hot water bottle now, or that tea or that drink, now's the time to do it. But please do tune in after the break, and then we will continue on with this amazing topic of discussion. And just to kind of like remind you, viewers, the topic today is the day in the life of a neurosurgeon, for which we have an amazing guest speaker by the name of Dr. Mohamed Draz. So we will continue after the break. So viewers, just doing what you need to do, and do not hesitate to tune in after the break. Bye for now. Assalamu alaikum, viewers. Welcome back to the Let's Talk show. My name is Samina Chughtai, and I'm your host for today. We're here live in the studio in Wakefield. So as we were talking just before the break, we were talking about sedentary lifestyle, as well as, some of the operations that our guest speaker, the surgeon, Dr. Draz, does, in his daily life as a neurosurgeon. So we're going to continue on with this topic. So Dr. Draz, sorry we had to have a short break, but you were talking about, the operations that you do on the spinal part of your patients. Can you just carry on, please, and just elaborate?
Yeah, so as we were saying, as neurosurgeons, we deal with different, diseases that comes to the spine or the brain. To talk specifically about the spine, we deal with the most common thing is the wear and tear on the spine, and that can be, things like the most common that comes to the patients is the disc prolapses, which comes in the lower back, or disc prolapses in the neck. And as I said before, only one in 10 of the patients that comes to us would require surgery. And that means that we just go in, take that disc that is causing compression on the nerves, which is the main source of the pain for those patients. And these surgeries usually successful to help them. And the main thing for us as neurosurgeons is to select the right patient who would benefit from this kind of surgery. Similar to that is the discs that comes in the neck, and Now I believe, in the next 5 to 10 years, we probably would see more of this because of the use of the mobile phones all the time. We're just using our mobile phones like this for a long time. Now younger generations are using mobile phones as well. So that creates a lot of tension on the neck and pressure, which I believe, as I said, in years' time, we'll probably will see younger generations having these diseases. So that's something that people needs to be aware of. And,
and that's the question that I actually wanted to ask you, because I wanted to ask you is that, these conditions, these diseases, the spinal problems, are they increasing? Because I certainly, and as you've just said, thought that they would be increasing because, most of us, well, a lot of us since COVID and now working from home have hybrid roles and we're using our laptops, whereas before, for example, myself, when I was working in the workplace, I was looking at a computer screen and it was a lot higher up. Whereas now, when I'm working from home, I'm using a laptop, even though it's a large laptop, it's quite lower down. So myself, personally, I do actually feel that strain. And sometimes I do feel as though, I've got a bit of backache. And so I'll work with, an extra large pillow behind me or a cushion behind me to support my back. And same with social media, as you've mentioned, because again, with technology and with mobile phones, lots of people, children, adults, youngsters alike, quite a lot of us, we can be on the phone for quite a long time. So you're finding that now, because of this, spinal problems are now on the increase. And what are those actual spinal problems? Is it a disc prolapse? Is it just a strain? Is it sciatica? Which would then possibly lead to surgery. Can you just elaborate on that, please?
Yeah. So the pain usually, the spine is formed by the bone and ligaments and muscle. Those are the things that support the spine, and the spine contains the spinal cord from inside, which carries the nerves from the brain all the way down to that supplies our arms and legs and every part of our body. And what happens is, if you have a weak muscles of the back, you don't exercise, you're not fit. Some people are obese, and that creates a lot of strain on the spine, either the neck or the lower back. And as you said, with during the pandemic specifically, everyone was working from home, sitting in front of computer for a long time. That also creates a lot of strain on the back. As a result of this, people will get back pain, which can be due to muscle spasms or due to strain in the back. But the extreme part, the extreme scenario of this is to have a disc prolapse, which slip of the disc, which is the cushion between the two vertebral bodies.
Okay.
And when that happens, basically bulges from out of its place, and the nerves are running around this. So as it bulges, it's just causing pressure on the nerve, and that creates a lot of pain for the patient.
And I was just curious to know, and I'm sure the viewers are curious to know as well. You often hear about people saying, "Oh, I've now got a slipped disc. I went to sleep and I woke up with it," or I just carried something or bent down, and the next minute I'm in agony. I've got a sore back and I've got a slipped disc prolapse. Yeah. So can you actually get that? What's the word? Symptoms or the feeling or the pain prior to it? Any warning signs that you're going to have a slipped disc, or is it just as easy as 1, 2, 3? That's it. Once you have a slipped disc, you have a slipped disc.
No, I think most of the patients would probably have a history, or coming to us and saying, "Okay, I've had back pain for a long time." That can be, can be years and can be as short as few months this time, and it depends on the patient body and physique and everything. Yeah. So, as a result of this, someone can have, if someone lifts something so heavy and his back is not strong enough, then a disc can rupture and goes out of its place and cause compression on the nerve. On the other hand, someone might have sitting for a long time and creating like chronic course of pressure on the back. They can also develop a disc prolapse at the end. But yeah, it can happen all of a sudden. But most of the patient will usually have longer periods of pain before that.
Okay, well, I suppose we could carry on, with this particular topic, but we know that we're only on air for a short period, so there's so many other questions that I would like to ask you. So can you just explain to myself? I would like to have an idea of the day in the life of a neurosurgeon. What is a typical day like?
So as neurosurgeons, we do multiple things. One
So,
is
so
yeah.
what I meant by that, sorry, Dr. Draz, what I meant
Yeah.
by that, so you wake up in the morning, you kind of like get
Yeah.
ready,
Okay.
and you enter the door of the hospital, of the Queen Elizabeth
Okay.
Hospital. So, can you take us through what actually
Yeah,
happens?
sure. Yeah. So it depends. Let's take an example of a day that I'm having operations or I'm in theater, as we call it. So you wake up in the morning. You probably try to be in hospital probably around 7:30, just to see the patients before the operation. If anyone needs to be consented or to talk to the patients quickly, probably they have been seen in the clinic beforehand. And then once that's done, we go for in our hospital. It's different between hospitals, but where I work, we go for what we call a team brief, which happens around 8 or 8:15, where all the team that is going to be involved in the surgery talk about the surgery, including the anesthetic team, including the neurosurgeons, including the theater staff, everyone. So we say what we need, what equipment we need, what instruments that we need, and if we are expecting any problems with this specific operation or with this specific patients, because some patients will be a higher risk compared to others.
Okay.
Then we go ahead. We send for the first patient. We go
Okay.
ahead.
And
Patient go
and I
ICU.
just wanted to ask you in that respect then. So you said,
Yeah.
doing surgery possibly for the most of the day after that, yes?
Yeah.
So
Yeah.
is there a particular mantra or is there a particular approach that you would take? Because obviously what you're doing is very serious. And I'm not a surgeon, but maybe some of these operations that you're doing is probably life and death possibly, or
Yeah.
making a condition worse rather than better. So do you have a mantra? Do you get nervous even after so many years?
Yeah, definitely. I mean, any surgeon who would say that he doesn't get nervous or doesn't get stressed from operating, he would be lying, I believe. You have to be in a certain amount of stress to get focus, but
Okay.
this stress, differs. So a first year, starting your neurosurgery training, you'll be very stressed with a specific type of operation, but the same operation after 10 years will probably be similar as you driving your car.
Okay.
And as you get older, you get more experience, and then the stress will be less. But again, you have to respect every operation, because at the point that you think, okay, I'm that experienced and then I can do everything. That's the point
Yes.
that things will go in the wrong direction,
So it's about,
unfortunately.
being focused. Yeah, being focused. Not being overconfident. Not saying, "Well, I've done
Yes.
this so many times." Being
Yeah.
focused, as well as collecting your thoughts and what's the word? Controlling your stress and your nerves as well. And then you go for it. And touch wood, then the patient and yourself come through that amazingly well. So I wanted to ask you, because you're doing surgery, a layperson like myself, I would be like horrified, okay, to do that. And hence that's why I'm not a neurosurgeon. So how has surgery had an impact on your question of faith, you being a Muslim, because it's about morality, it's about life and death, it's about serious conditions, meeting people that are really fragile. So how has it affected your faith, if anything?
Well, that's interesting because I would answer that question in two parts. The first part is, it definitely affects you because you think about the conditions that you see.
Dr.
You think
Draz,
about
I'm sorry, but can you make that answer really quickly? Only because we're going to
yeah,
be
sure,
off
sure,
air
sure, sure.
soon.
So as I said, it definitely affects you because you think about a young patient who's coming in through the door who is fit and well, 25-year-old patient, and he might die. And you think about you might be in the same situation, and you can die at any second or at any point. So it definitely strengthens your relation with Allah, and you think about what you need to do in life and what's your purpose of life. So
Okay,
yeah.
okay. Mashallah, mashallah. And so, unfortunately, it's Now we're at the end of the show. Again, the time just goes so quickly. I'm so sorry, Dr. Draz, but it's been amazing to have you on the show. And viewers, I hope you've gained lots from it, as much as I have. It's just a skeletal overview of what Dr. Draz does as a neurosurgeon. And please do tune in onto his channel, YouTube channel, Neurosurgery. It's called The Neurosurgeons, and you'll be able to find out more about it. But viewers, I'll have to end there now. We're very much at the end of the show, but please do tune in next week, and it will be wonderful to have you back on the show again and listening to myself, Samina Chughtai, your host.